Our incoming freshmen, I always advocate abstinence. I always think that is the best option, not only for pregnancy, but also for STIs, STDs. We do offer free condoms here in the Wellness Center. That is something we encourage all of our students to utilize if they are having intercourse. We definitely don't want our students to be having unprotected intercourse, so we try and do our best to educate them, and those are available all year round. STDs are definitely on the rise right now in South Dakota and across the country as well. We see here on campus, we do see a lot of chlamydia amongst our students, so we try and do a lot of education to help our students not get those diseases. Definitely, if you notice any signs or symptoms of any sort of STI or STD, you should definitely come in and be checked either by a nurse or your regular provider. It's definitely not something you want to just let go. Oftentimes with chlamydia, patients don't have any signs or symptoms, so it's very important to be screened on a regular basis, especially if you're having unprotected intercourse. Other symptoms might be like discharge from the genitals. You might have urinary tract infection type symptoms, so burning with urination, frequency with urination, or urgency. So those are some other key things that you would want to pick up on. Syphilis, oftentimes patients will see a painless ulcerous sore on their genitals. Otherwise, it can also be in the mouth. It can be also in the rectum. Otherwise, patients might also see a rash that is most commonly seen on the palms of their hands and the soles of their feet. But it can be also in other parts of the body as well. If our patients come in and are concerned that they have an STD, kind of depends on their symptoms what we're going to do for them. If they're having burning with urination, frequency, urgency, maybe some discharge from the genitals, we like to do a urine sample, and that will test for chlamydia and gonorrhea both. If they're concerned about herpes and they're having these open sores or syphilis and the open sores or the rash, that would be a blood test that we would do. HIV is also a blood test. Viruses would include herpes, hepatitis, HIV or AIDS. Otherwise, the bacteria that we can treat and cure for people would be chlamydia, gonorrhea, syphilis, trichomoniasis, or trich. Trich is actually a parasite that can infect the genitals. Oftentimes, it might not have symptoms again, or you might have a lot of discharge or those UTI symptoms. When I'm going through education with my patients, I always go through all of our STDs on one of our pamphlets and explain signs or symptoms and how to protect themselves from getting those infections. I also encourage abstinence from getting any of those STIs, and also I encourage condom use. We encourage all our female patients to have an STD screening at their annual exam. That is their choice if they choose not to. However, we do recommend it if you have been having unprotected intercourse. And as far as for men, we say if you are having unprotected intercourse, at least come in once a year, but we really encourage at least 2 to 3 times a year to have those screenings done. And it is just a urine sample, so it's not anything painful.